The first plenary session this morning was about smoking and its role in carcinogenesis and the importance of smoking cessation and of screening. And so it was interesting to hear those talks, the continued importance of screening as we understand it, with a reduction in mortality of 20%, very significant for heavy smokers, reduction in that and an update on that. And then the continued worried about smoking epidemiology, how worldwide it's a phenomenon, even in the US. It sounds like progress when only 17% of the population now smoke, as opposed to close to 50% in earlier times. But for those 17%, it's still a very significant risk of downstream developing cancer. And increasingly, I think there are socioeconomic concerns that the populations who smoke tend to be on the poorer side, socioeconomically speaking, of society. And then a very interesting talk that had to do with is it important for people who are already patients to stop smoking, and very suggestive evidence that it is important, that continued smoking decreases the risk of, decreases the potential of curative therapy, and that it would be advisable for patients to stop smoking and pursue treatment without further exposure to tobacco.